So hip arthroscopy is a relatively new procedure, meaning that it's been around for 20 plus years, but there's definitely a more selective group of orthopedic surgeons that perform that type of procedure. So it's a little bit more specialized than some of the other conditions that are more commonly treated. When we're talking about hip arthroscopy, most commonly we are treating a condition called hip impingement. And impingement happens when there is a variation in the structure of the ball and socket of the hip joint, where the ball normally has a nice quick taper to this skinny region of it called the neck. And for developmental reasons, some patients don't form quite as sharp a taper in this front part of the neck region. And that leads to a problem as patients flex their hip up, where that extra bone that sits in the front portion here will abnormally contact the rim of the socket. What lives around the rim of the socket is a structure called the labrum of the hip. It's a piece of cartilage that serves as a suction seal for the hip joint. And when the abnormal amount of bone compresses or pinches the labrum, it can cause damage over time and lead to pain in the groin region. So if patients fail to improve with less invasive approaches like physical therapy and medication, we sometimes will consider arthroscopic surgery to address this problem. And arthroscopic surgery of the hip involves placing the leg in a little bit of traction to be able to separate the ball from the socket of the hip joint. And that creates a few millimeters of space that allows us to be able to insert our fiber optic camera inside the joint and address the problems that we can visualize. Very commonly, we will fix the damage to the labrum here along the edge of the socket, and we will remove any extra bone on the edge of the ball or the rim of the socket, so that when we start to take the hip through a range of motion again, there's no longer that abnormal bone contact that will pinch the labrum anymore. So we have to address both the problem with the labrum as well as the problem with the bone to be able to alleviate patients' pain with the condition of hip impingement.